you matched into surgery and then you matched into psychiatry. Do y'all want to talk about how did you obtain that? Because that's very competitive. And how Avalon helped you.
Sure, I guess I can go first. So, I've wanted to be a surgeon since I was, you know, way before undergraduate. This was a kind of a dream for me. Avalon sort of prepared me. We did like mock interviews. Dr. Ghani, he's a general surgeon, and he sort of, would ask me these comprehensive questions like, how would you manage, small bowel obstruction? How would you manage, postoperative ileus? Like, how would you, they ask you some of these questions in the interview just to gauge your level of training, your level of diagnostics. And so that was really helpful for me. I also got the opportunity to work with a number of incredible general vascular ENT surgeons. And so I was able to have quite a bit of surgical experience when I was going to the interview. I managed to log close to 500 surgical hours of assisting through my 2 years of clinical rotations, and I also was able to do some research. There are some preceptors that are very research oriented, and if that's what you're looking for, they provide you the opportunities to do case reports and publish research articles. So that's kind of how I was helped along this path.
Yeah, so typically there's two types of students that enter medical school. One are those types of students that know what kind of physician they're going to be, like Dr. Lamprakos mentioning that, yeah, I'm going to become a surgeon. And the other type, they walk into med school saying they want to be one thing, they end up becoming something else. And that's the beauty of medical school, because through your exposure of clinical rotations, you really find what you love. And I was the latter type of student. So I walked in saying I wanted to be a plastic surgeon. And I remember discussing with Dr. Lamprakos in our Beckley rotations about interest in surgery. However, when I did my psychiatry rotation, it was like love at first sight. I felt like I could really help that patient population, and kind of the stigma that they face, kind of help to address that. And and my experience in psychiatry was very vast. I was able to do a couple procedures which I didn't know even existed in psychiatry, like electroconvulsive therapy, TMS, those things. So that really changed my framework about the field, and I decided to do further electives in psychiatry to improve my exposure. Through that, I came across great mentors, great attendings that helped me and wrote me amazing LORs that eventually helped me during the application process for residency.